Thank you. Senator Collins.
Dr. Fauci, first let me make clear that I believe in the efficacy of vaccines and have encouraged my constituents to become vaccinated. But I'm hoping you can explain what appears to be a contradiction when I look at the data for the state of Maine. Maine ranks in the top 5 states in the number of people, the percentage of people who have been vaccinated. In fact, 95% of those over age 65 have been fully vaccinated. And yet, Maine has the 15th highest confirmed deaths from COVID on a per capita basis. Our hospitals are overwhelmed. We've seen a 6% increase in hospitalizations, 18% increase in people in the ICU, a 37% increase in people on ventilators recently. And while it's largely individuals who are unvaccinated, there are some that are breakthrough cases. And all of us know individuals who, despite being fully vaccinated, have experienced COVID. Can you explain to me why a state that has done a terrific job in getting people vaccinated is seeing this surge in cases that is overwhelming our hospitals and causing great fear and pain and loss?
Well, thank you for that question, Senator. Well, first of all, I think you did say something just a moment ago that I think is part of the explanation. You said that most of them are among people who are unvaccinated. However, and it's quite true, that there are breakthrough infections because no vaccine is 100% protective and you will always get breakthrough infections. In general, for the most part, breakthrough infections for people who have been vaccinated, all other things being equal, are usually less severe, don't lead as much to hospitalizations, and don't lead to as much as death. The data, though, in general, as was mentioned, I think specifically the numbers that were given by Dr. Walensky are incontrovertible, that a vaccinated compared to an unvaccinated person has a multifold less likelihood of being infected, a multifold less likelihood of being hospitalized or dying. So I think there are probably confounding multiple factors going into the difficult situation that your citizens in your state are going through. But there's no doubt that the vaccines clearly much, much better in the sense of protecting you from infection, hospitalizations, or death compared to the unvaccinated.
Dr. Walensky, parents, teachers, and pediatricians have all talked to me about the learning loss, the emotional and behavioral health problems that have occurred among children due to their not being in school. And in contrast to the quarantining option, the test-to-stay approach allows asymptomatic students who test negative for COVID to remain in school rather than quarantining after another student or staff member has tested positive for the virus. A Lancet study shows that case rates were not significantly higher at schools that use the test and stay approach versus schools that require students to miss school and quarantine at home. And indeed, your home state of Massachusetts has adopted a test-to-stay strategy. Brown University professor Emily Oster has expressed great frustration with the CDC as being slow to take a stronger position in favor of test-to-stay, asking what evidence are they waiting for. She says school quarantine should end and be replaced with test-to-stay or nothing. Another public health expert says simply, it's madness to quarantine school children. The CDC policies hinder learning and provide no meaningful reduction in COVID transmissions. My question for you is, why doesn't the CDC issue guidance or recommendations to encourage school districts to adopt test and stay in order to avoid these highly disruptive quarantines of students who are asymptomatic and could be tested?
Thank you, Senator. Thank you for that question. When you and I spoke in this room or in this venue in July, we share the priority of getting our children back to school. I've said it's the first place that should be open and the last place, the first place that should be open and the last place to close. In that context, we have studies just this school year that have demonstrated that we have 96% of our schools open, for which I'm very pleased. And still, we have 4% of schools, over 1 million children, who've been impacted by COVID-related outbreaks, and those schools have had to be closed. Our data also demonstrate that our prevention measures have been working. In schools that are practicing the prevention measures, including masking, they've been 3.5 times less likely to close because of a COVID-related outbreak than those who have masked. But your question is important. These are new data out of the UK that have demonstrated this new test to stay strategy. That is a strategy after a child is exposed in a classroom, that they stay in that classroom with sequential tests every day, every other day, to demonstrate that they are negative so that they can stay in school. We have updated our frequently asked questions that this is a promising practice, and we're actually working with local jurisdictions now to demonstrate the domestic data here in the United States that this practice works, it's safe, it's effective, it gets our children back to school. And importantly, we recognize that jurisdictions are actually doing this, and other jurisdictions may want to. And in that context, we're doing peer-to-peer matching of schools that are interested in doing the test to stay practice and having them talk to schools that are also doing it so they can use the implementation strategies that a school has already used. So we're actively studying this so that we can provide the data on it working, and we're actively encouraging it as a promising practice. Thank you.
Thank you.
Thank you. Senator Smith.
Thank you, Madam Chair and Ranking Member Burr, and thank you so much to our panelists for being with us today. So I